Hello everyone, myself Vimal, the Assistant Professor, IIMT College of Pharmacy, Datt, Noida. Today I am going to discuss about RIA, also known as Radioimmunoassay. RIA is basically a type of biological assay based on radioactive compounds such as tritium, carbon-14, iodine 125, and iodine 131. RIA is basically used for the analysis of or detection of antigen by using radioactive compound labeled with an antibody. So before understanding what is radioimmunoassay, we have to understand what is immunoassay. So I'm moving to the next slide. So immunoassay. An immunoassay is test that uses antibody and antigen complex as a mean of generating a measurable result. Antibody antigen complex is also known as immunocomplex. Immuno refers to an immune response that causes the body to generate antibodies, and assay refers to a test. Thus, an immunoassay is test that utilizes immune complexing when antibodies and antigen are brought together. In short, we can say immunoassay that uses radioisotope are termed as radioimmunoassay. So here are some basic terms commonly used in RIA, such as antibody, antigen, and analytes. An antibody is a protein that is produced by the body in response to an invading foreign substance. And antibody are produced as a part of body's immune response to protect itself. And antigen is a substance the body tries to fight off by mounting an immune response. For example, any bacteria, virus, anything which is able to cause any disease is the antigen that binds to the body that binds to the antibody. And an immunogen is a substance that elicits an immune response, that is drug, protein, conjugate, and analyte is an anything measured by a laboratory test. So here are some points about RIA. RIA radioimmunoassay uses antibody to detect and quantitate the amount of antigen analyte in a sample. An in vitro assay measures the presence of an antigen with very high sensitivity and utilizes radioactive isotope as a label. Here, radioactive material are not administered to the individual but are used as a reagent. The amount of radioactivity is then measured is indicative of the amount of analyte present. Nanomolar and picomolar concentration of hormones in biological fluid can be analyzed through this method. It is both qualitative and quantitative analysis. It has a sensitivity to identify 0.001 microgram per ml of antigen. Principle of radioimmunoassay. The basic principle of radioimmunoassay is competitive binding, where radioactive antigen tracer compete with a non-radioactive antigen for a fixed number of antibody or receptor binding site. Uses an immune reaction, antigen-antibody reaction to estimate a ligand. In next one, Ag plus Ag star plus Ab is equal to Ag plus Ag star Ab plus Ab plus Ag plus Ab, in which Ag star means unbound antigen, Ag means washed out radioactivity of bound residue measured ligand concentration is inversely related to radioactivity. Ag ligand to be measured and Ag star means radio labeled ligand. In this equation, or in this equation, the Ag means unbound antigen, that is our invading antigen, and Ag is labeled antigen, and Ab means antibody, that is used for the detection purpose. And then they will make some complexes such as AgAb, in which AgAb is complex of antigen that is not labeled with radioactive substance, and Ag star AB is complex of antigen with antibody in which antigen is radio labeled, and some free antigen and antibody are also present in the solution. So we are moving to the next slide. Essential component of RIA. Some essential component of RIA are tracer, that is labeled antigen, antibody, a standard antigen, known concentration of unlabeled antigen, unknown sample, separation method, and method for detection of a label. Radioactive compound used for labeling of an antibody are tritium, carbon 14, isotope of iodine, that is 125 iodine and 131 iodine. Then this radioisotope of tritium and iodine incorporated into either antigen or antibody. Tagging should not affect antigenic specificity of and antigenic activity. The labeled antigen tracer must be present in low concentration. Once labeled, it must maintain the same characteristic of the unlabeled antigen. I-125 is preferred over I-131 because its longer half-life, ease of handling, and higher counting efficiency. Antibody. Here are we use monoclonal antibody and polyclonal antibody. Monoclonal antibody. These antibodies are produced from one type of cell, and antibody bind to one epitope of antigen, and polyclonal antibody made by injecting an animal with the antigen, then purifying the antibody from serum. Antiserum contain a mixture of antibodies, recognizes and bind to the same antigen but attached to the different epitopes. In these diagrams, we can observe that this antibody is only bind to one and epitope of antigen. And in next diagram, we can observe, we can see that four antibody can bind to the same antigen at different epitope sites. So standard antigen. In this slide, we discuss about standard antigen. Standard antigen means it is the same antigen that was injected into animal for antibody production. For every antigen, a specific antibody is produced by the body. So if we are identifying any specific antigen, we have to produce antibody for that antigen. So we use that type of antigen and inject it into the animal. After that, the body of that animal will produce antibody in against that specific antigen. Then before the antigen can be used as a standard, the specificity between this antigen and the antigen in test sample was the antibody. Binding sites must be clearly established, and an international organization like WHO issue a standard preparation characteristic of standard antigen, such as it should be available in large quantity, it should not contain substance which can interfere with assay, should be highly purified, should be available in form which allow convenient and accurate preparation of for RIA. So these are the some characteristics we have to follow before choosing an antigen. So in next slide, this is the assay procedure. So this is the whole procedure through which the assay is performed. The RIA is performed. The procedure starts from a known quantity of antigen is made radioactive, then this radiolabeled antigen is then mixed with the known amount of antibody for that antigen, and as a result, the two chemically bind to one another. A sample of serum from a patient containing a known quantity of that same antigen is added. This causes the unlabeled or cold antigen from serum to compete with the radio-labeled antigen for antibody binding site. As the concentration of cold antigen is increased, more of it binds to the antibody. And by displacing the radio-labeled variant, and reduces the ratio of antibody bound radio labeled antigen to free radio labeled antigen. The bound antigen are then separated from the unbound ones. The radioactivity of the free antigen remaining in the supernatant is measured. Separating bound from unbound antigen is crucial. Initially, the method of separation employed was the use of a antigen, second antibody, that is immunoglobulins. In next slide, we can understand the whole procedure through an image. In this slide, uh, we are showing 6 people, in which one is control and second for unknown sample. So for control, a known amount of radioactive label antigen are present in a beaker. Then we add fixed amount of specific antibody. And in next addition of anti-immunoglobulin antibody precipitate the antibody labeled antigen complex. Radioactivity in precipitate is measured. So in this process, we use radio-labeled antigen. Firstly, we produce radio-labeled antigen, and then we add antibody, and then through the reaction, the radio-labeled antigen bound to the antibody. So these complexes are then precipitated or separated by next antibody, that is also known as anti-immunoglobulin, which precipitate out the antigen antibody complex. After that, we measure the radioactivity of that precipitate, and when we measure the radioactivity of that precipitate, we found 100% radioactivity in that precipitate formed by this process. Okay, and then in next process, unknown sample, known amount of radioactivity actively labeled antigen mixed with unknown amount of unlabeled antigen. Unlabeled antigen compete with labeled antigen for the antibody, and then addition of anti-immunoglobulin precipitates the antibody antigen complex containing labeled and unlabeled antigen. The difference between the radioactivities in the control and the unknown sample is proportional to the amount of unlabeled antigen in the unknown sample. In this process, we add both. Unlabeled antigen and labeled antigen. After that, they compete with each other to bind to the antibody. We add antibody, and then anti-label and unlabeled antigen and labeled antigen compete with each other to bind to the active site of antibody. After binding with the active site of antibody, we precipitate out this complex with the help of anti-immunoglobulin. After that, we just measure the radioactivity of the precipitate and supernatant also. And then in next slide, this process would be real. So in this slide, here we are seeing that radioactive antigen bound to the antibody, and this is also known as first antibody. Okay, and then we add unlabeled antigen that is shown by blue dot, and then unlabeled antigen compete with labeled antigen for the binding site. So by displacing the labeled antigen, it attached to the active site of antibody. So radioactive antigen displaced by unlabeled antigen, and then precipitate antigen antibody complexes with anti-immunoglobulin. That is second antibody. So second antibody indicated by green color. It bound the two antibody antigen complexes with it and precipitate out the mixture. And then in next slide, we discuss about advantage and disadvantage of radioimmunoassay. Radioimmunoassay is very sensitive technique used to measure concentration of antigen in very short time. It is structurally specific as antigen-antibody reaction are highly specific. It is indirect method for analysis. It is saturation analysis as active reagent added in smaller quantity than that of analyte. Disadvantage: prolonged reaction time in days. As consequence, highly diluted reagent is used. Radioactive iodine used in is not cheap reagent. Possible health hazard due to handling of radioisotope. All the reagent must be added precisely. Limited assay range, lack of direct linear relationship between analyte concentration and signal response. Difficulty of automation, lengthy counting time. So here we are going to discuss about some application of RIA, narcotic drug detection. So this we can also say it is used for doping test, blood bank screening of hepatitis, a highly contagious condition, early cancer detection, measurement of growth hormone level, tracking of leukemia virus, diagnosis and treatment of peptic ulcer, research with brain chemicals called transmitter, refinement of calcium pharmacokinetics, estradiol measurement in translational study of breast cancer, significance of prostate specific antigen in prostate cancer patient and in non-cancerous prostatic disease patient. Evaluation of enzyme immunoassay and radioimmunoassay method for the measurement of plasma oxytocin. Thank you.